there, Marcy Zwelling here, and I want to talk to you about some of the medications that we can use now for diabetes. Of course, you only know what medication is best if you understand the principle of the disease. So let me do a little bit of explaining and why some of these medications are important. First of all, let's talk about diabetes. Very simple here. This is the pancreas. Inside the pancreas, we have these things called the islets of Langerhans. Inside the islets, we have a thing called a beta cell. The beta cell makes insulin. Now, interestingly enough, this beta cell, like so many cells in our body, it gets old and decrepit. It is very robust when we're young, and not so robust as we get older. It is a beta cell function and dysfunction is what most of diabetes is about. That and what we call insulin sensitivity. Insulin sensitivity or insulin resistance. When you go to the doctor the next time, you need to ask your doctor, am I insulin resistant? And what is my beta cell function? This will address the question of specifically what you need to treat your diabetes. Insulin resistance is a disease that's just very much like an older car. An older car where the accelerator is not quite as responsive to your foot, where you have to really floor that accelerator to get that gas into the carburetor to get it going. Well, in the case of some of us, as we get older, our cells become what we call insulin resistant. And we need more and more insulin to do the same job. When you need more insulin, you need your beta cell to work even harder and with more robust activity, and at the same time when it's getting older and less robust. So that's the problem of diabetes. With respect to insulin resistance, we have several drugs, metformin being a drug of choice. And because insulin resistance is such an important part of diabetes, you can ask your doctor, am I insulin resistant? Get a fasting insulin level and almost know that answer immediately. Get a 2-hour glucose tolerance test and know what your beta cell function is like. And you can get the answers right then and there. Now, if I tell you that it's about insulin resistance, what we need to do is fix the insulin resistance. We just don't keep pumping, we don't just keep pumping more insulin necessarily into the system. Metformin is a very good drug for insulin resistance. With respect to beta cell function and beta cell robustness, there are several drugs that are helpful. Actose actually helps maintain beta cells, and GLP-1 enzyme inhibitors, otherwise known as Januvia as an example of that drug, are known to maintain beta cell function and beta cell mass. Those two drugs are probably the key to either preventing diabetes, prolonging the time until you will get diabetes, and managing your diabetes without having to get a glucometer and manage what your glucose is all day long, without having to take insulin injections. Insulin is cheap, and the government would like you to be able to use insulin. But insulin is very difficult to use. The more insulin you have in your body, the higher your blood pressure, the hungrier you are. Insulin is not something that you want to have in excess. That is why you must treat the insulin resistance. So using a drug like metformin, and Actose actually helps with insulin resistance as well, you can actually treat the underlying problems, insulin resistance and beta cell dysfunction. By treating the underlying problems, you can actually prevent or prolong the onset of diabetes. That's how you treat diabetes, not necessarily by pumping insulin into somebody's body.